Hello everyone, this is Medical Gateway, and in this part we're going to study regarding the leukemias. Now, what exactly are the leukemias? Now, leukemias are basically the cancerous mutation in myelogenous or lymphogenous cells. So, leukemias are basically commonly known as blood cancers, or basically the cancer of white blood cells. Now, as you know, what happens in cancer? In cancer, there is uncontrolled production of cells, and the cell becomes abnormal. So, basically, in leukemias, there is uncontrolled production of white blood cells. So, there will be increase in the number of white blood cells. But these white blood cells are not the normal white blood cells. What is the function of the white blood cell? The function of the white blood cell is to protect the body against the foreign infections. But these abnormal white blood cells are unable to protect the body against the foreign infections. So it's a paradox that we have a lot of WBCs, but they are unable to function well. So this is one thing. And the other thing is, whenever there is increased in the white blood cell production, these cells will invade the normal bone marrow. So when these cells are going to invade the normal bone marrow, it will result in decreased in production of red blood cells as well as decrease in production of the the platelets. So we have increase in white blood cells, the increase in abnormal white blood cells, decrease in red blood cells, and decrease in platelets. So what the patient is going to suffer from? Because of the red blood cells, decrease in red blood cells, he will feel lethargic, he will feel weak. Because of the decrease in platelets, there are bleeding tendencies. And because of the increase in abnormal WBCs, he will suffer infections. So there is a combination of lethargy, bleeding, and infections in the leukemias. Okay? So white blood cells will invade the bone marrow, and the production of RBC and platelets is also affected. Okay? And now, other than these WBCs, platelets, and RBCs, from where they all are being produced? They all are produced from the bone marrow. So basically, the bone marrow has myelogenous cells. So the cancer is basically inside the bone. So as the cancer is inside the bone marrow, it will result into weak bones. As you know, the cancerous cells require a lot of nutrients. So the nutrients which are normally being utilized by the normal bone cells, now these nutrients will be utilized by the leukemic cells. So the bones become weak, and there is high tendency of the bones to get easily fractured. So the person is having a lot of infections, has bleeding tendencies, is lethargic always, and has bone fractures. So this is the whole case of leukemias. Now, the leukemias, depending upon which lineage is being affected, the leukemias can be myelogenous leukemia or the lymphogenous leukemia. So myelogenous leukemias involve the neutrophils, the eosinophils, the basophils, okay, the granulocytes. So if the neutrophils are only involved, then this is neutrophilic leukemia, and if the eosinophils are involved, it's eosinophilic leukemia, and if the basophils are involved, it's basophilic leukemia. So this is very interesting, that if the leukemia is differentiated, partially differentiated, so if the leukemia is of early cells, it is undifferentiated. But if the leukemia is as such that we can differentiate that they are neutrophilic leukemia or eosinophilic or basophilic, then it means the leukemia is partially differentiated leukemia. And the good thing is that partially differentiated leukemias have a good prognosis. Then we have lymphogenous leukemias. So in lymphogenous leukemias, which cells are increased in number? The lymphoid cells, the B lymphocytes, and the T lymphocytes. Okay? So in myelogenous leukemias, neutrophils, eosinophils, and basophils are increased, whereas in lymphogenous leukemias, B lymphocytes and T lymphocytes are increased. Okay, and now from where they are produced, the myelogenous cells are produced from the bone marrow, whereas the lymphogenous cells are matured in the lymphoid organs. Okay, so you can see the involvement of bone marrow, lymph nodes, spleen, and liver, and other lymphoid organs in the leukemias. Okay, so these were the types, but the main thing to focus in it is that in their increased number of WBCs, but they are not working well. As the bone marrow is involved, that will lead to decreased RBCs and decreased platelets also. And finally, they all can cause weak bones, resulting into fractures. So these were leukemias. See you in next part.